you need access to record or would like to ask a question, please let us know in the chat, as several of you have already, I see. You don't need to tell us your question, only that you have one. And please also include your affiliation. We have 30 minutes for the press conference today and limited time for questions. So please be considerate of others' time and only ask one question. If there are remaining questions when we conclude and you haven't had yours answered, please submit your question in the chat or by email, and we'll get you a response in writing. We'll begin in just a few moments after we grant recording permissions. Okay, I believe all the recording permissions have been granted. If you requested permissions, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we'll hand it over to you now to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, the weather has certainly turned a lot cooler, and while so many of us enjoy fall and all that comes with it, fall also signals that respiratory virus season is fast approaching. Now, fortunately, here in Ohio, right now we have low levels of RSV, flu, and COVID-19. But we know from past experience that as the weather changes and we're all inside more, it's inevitable that we will begin to see more viral activity. Now, typically, we experience an uptick that begins around Thanksgiving and then a peak around Christmas, followed by a second peak, and usually larger, toward the end of February. What this means for us right now is that this is a very good time to be thinking about getting a vaccine, whether for RSV, flu, or COVID-19. Now, I want to outline here the current recommendations for who should get these vaccines. First, starting with RSV, the CDC recommends vaccines for, first, anyone over 75 or those between 50 and 75 who may have an increased risk of severe RSV, including those with chronic heart and lung disease and those with weakened immune systems. Another group for whom the vaccine is recommended would be pregnant women in their 32nd to 36th week of pregnancy between September and January, so now. We have a very good vaccine available for them. Or babies born between October and March whose mothers did not get the vaccine, they're eligible to receive an RSV antibody shot. Now, turning to the flu, the CDC says that an annual flu shot is recommended for anyone 6 months of age or older. For COVID-19, the CDC has emphasized shared decision-making while preserving the availability of the vaccine for all ages, including children who are eligible for the Vaccines for Children program. The recommendations from the FDA and CDC underline the fact that those age 65 and over are at particular risk, as well as those with a wide range of medical conditions that can increase your risk of contracting severe COVID-19. The CDC encourages you to have a conversation with your provider who can discuss your personal medical history and help with informed decisions. We know that many people go to pharmacies to receive vaccines, and it's important to note that Under Ohio law, pharmacists, pharmacy interns, and pharmacy technicians are permitted to administer COVID-19 vaccines to any person 5 and up without a prescription. We do recommend that you call ahead to a pharmacy to ask about availability and any vaccine policies they may have. Of course, vaccines protect us from a wide range of serious illnesses, including measles. Sadly, we continue to see outbreaks of measles across the nation this year, and even here in Ohio, we had a cluster of cases not long ago in the greater Columbus area. The fact is that we continue to see too many people contracting illnesses that can have very serious health effects, whether it be measles or more commonly pertussis, which is also known as whooping cough, which can be particularly harmful to very young children and infants. For decades now, we have had very safe and very effective vaccines for serious diseases that include polio, tetanus, rotavirus, flu, pneumococcal disease, hepatitis, and many others. So I join countless healthcare providers in encouraging everyone to stay up to date on their vaccines. Now, I'd like to turn to our main topic today, which is school-based health centers. These are just what they sound like, a medical office housed on the grounds of a school. They're open to serving students and their families, school staff, and many also see members of the community. School-based health centers are not a brand new concept. According to the Ohio School-Based Health Alliance, the first one opened in the state in 1995. But in recent years, under the leadership of Governor Mike DeWine, the state has jumped into this space with both feet and supported the addition and expansion of many more centers. The Ohio School-Based Health Alliance now lists 138 centers operating in Ohio. The Ohio Department of Health is just one state entity that has supported these centers. The Department of Behavioral Health, the Department of Education and Workforce, the Department of Medicaid, and the Department of Development through the Governor's Appalachian Children's Health Initiative have also played key roles in this effort. The Ohio Department of Health began supporting school-based health centers in 2022, initially using federal COVID-19 relief funding. With this generous support and then further generous support from our own General Assembly, we've continued to be able to support these centers with $15 million in general revenue funding in the last budget, that was fiscal year 2024 to 2025, which has increased to $20 million in the most recent state budget passed in July for fiscal years 26 and 27. With that funding from our legislature and previous funding, so far through the 2024-2025 school year, ODH has supported school-based health centers in 49 school districts in 27 counties. This major investment is because we recognize the importance of improving access to health care. Because they're housed in schools, medical care is now available in a trusted and familiar community setting, a place where students, families, and the community already gather. This can help overcome many of the barriers that we know sometimes prevent people from seeking care, such as a lack of reliable transportation, the challenges of a parent or guardian taking time off work to take a student to an appointment, or simply an inadequate number of providers in a particular area. Research has shown that school-based health centers not only can improve students' health, but also support academic success. Data that we've recently begun gathering from several of our ODH-supported centers shows that kids miss less class time, gaining about 3 hours of additional instruction time compared with leaving school for care. Now, earlier I mentioned the increased funding the General Assembly awarded us in the most recent budget. In the current fiscal year, we have awarded nearly $8 million to a total of 29 grantees. Now, these grants serve different purposes. Some are for planning that is needed before launching a new school-based health center. Some grants are to help defray the startup costs of opening a new center. And finally, some grants are for the expansion or enhancement of services at existing school-based health centers. We are very excited that we can play an important role in launching and expanding these school-based health centers that help improve the health of students and entire communities. And now, to help us better understand school-based health centers and the work that happens there, I want to welcome in our guests, Dr. Mary Kay Irwin, Senior Director of School-Based Health Services at Nationwide Children's, and Dr. Sara Bode, Medical Director of School-Based Health Services at Nationwide Children's. Now, Nationwide Children's has been involved with these centers for years, and over the past several years, they have been a valuable partner in the state's efforts to open new centers and expand existing ones. So, doctors, as we've mentioned, school-based health centers can serve students, staff, and the community. Could you perhaps outline a little bit more about how these centers function? For example, how do people get to see a provider? Do they make appointments or walk-ins accepted? And what about the students who may fall ill during the school day? And also, we all know about school nurses. What role do they play with a school-based health center? And how do these centers assure that parents are involved and able to give consent? I know that was a lot, but if you could just outline some of those issues.
Of course. So school-based health centers generally operate with flexible scheduling. So certainly appointments are made, and we have appointments for preventive visits, such as for well visits and vaccinations. But it's important to remain very flexible for children who may fall ill during the day. So unlike a traditional outpatient clinic setting, if you say, for example, have a couple of children on the schedule for a well visit, and all of a sudden, unexpectedly, someone needs us immediately, we have the ability to move that well visit to the next day because we're going to be at school just like that student will be tomorrow, right? And so we very much want to be flexible, and most people in school health, are very flexible. That also includes accepting referrals from just about anybody. So, of course, parents, we have great relationships with our parents, and they can call in and make appointments for their children. Sometimes older high school students refer themselves and seek care on their own. And also teachers, school nurses, coaches, all refer students into a school-based health center. Very important to note, though, care is never delivered without parental involvement. So all care is consented care, and that can look a number of ways. First and foremost, parents are always welcome to attend an appointment at a school-based health center, but it's often not required. We're trying to reduce barriers. One of those barriers being that, mom or dad has to take off work to shepherd the child to the appointment. So in the event that mom or dad is unable to attend the appointment, that's okay. We make sure we have the consent for the appointment. And if mom wants to speakerphone in or FaceTime into the appointment, that's encouraged. Or if that's not an option, we may call her after work to tell her how the appointment went. Dr. Bode, you want to talk about school nurses?
Yeah, so just a note on that parental consent. Obviously, we're talking to parents before, during, after, and like Mary Kay mentioned, the key to that is flexibility because we know parents often have jobs where they may not be able to be talking at the time of the appointment, but they are absolutely involved in every aspect of their child's care. The school nurse is integral to the success of school-based health centers. School nurses are providing care for students day in and day out in the school setting, and they're often the eyes and ears that might know or identify issues that are coming on. So a child falls acutely ill during the school day, their first stop is to the school nurse where they're doing their job, triaging that student, understanding what's going on. If they're determining that they would benefit from a doctor's appointment that day, then they're often communicating with the parent and with the clinic, and we're arranging that in real time for them to walk over. So this is really a great relationship back and forth, and the school nurses are invaluable to identifying the success of that. That can also include chronic diseases. They might be a student that's coming down to the nurse's office for abdominal pain over and over again, and we're trying to figure out what might be going on. So really an open door policy, as she mentioned, to ensure that we're getting everybody in, whatever their issue may be, and getting their needs met.
So, I was at a opening of a school-based health center in Blair, Ohio, not all that long ago. That's a center that Nationwide Children's played a very important role in helping with the startup of. And they were seeing folks from the community as well. Could you speak a little bit to the security set up in terms of some of these centers being open to the public, but also protecting the school environment?
Sure. So some school-based health centers are embedded deep inside of the middle of a school. Maybe it's a classroom that has been converted into a doctor's office. Other times, school-based health centers are a little clinic in the parking lot, or even an addition onto the school itself. In an ideal circumstance, school-based health centers have both an internal and an external entrance. What I mean by that is internal to the school, so that students who want to be seen can access the clinic without leaving the building. And then the external entrance for community members, children from the community, moms, dads, grandmas, and grandpas that would like to seek care for themselves. But that's not always possible. And so when a school-based health center is embedded inside of a school, it's great for engagement, with the student body. And then what basically that center has to commit to then is a little bit extra effort to ensure when people from the community are coming in. So that looks slightly different with every operation, but generally speaking, when we see patients from the community, they are buzzed in through the front office. They are stopped at the front office and sign in, and the provider usually sends an assistant down to the office to escort the patient back to the school-based health center, and then we see them out of the building. So there's a number of different things that can be done, and cameras can be leveraged, of course, all the different things that can be done from a safety perspective, and we take that very seriously and partner with our school districts to ensure that we are following their safety procedures as well.
So can you just walk us through what one might encounter if they were to actually go to a school-based health center? What does an office look like?
So these offices
Go
can
ahead,
look
Sarah.
very
Yeah.
different. Some of our offices can look like, as you would imagine, a medical home setting. They might have multiple exam rooms. It might look a similar setting to you. Others, as Mary Kay mentioned, have to be pretty flexible. We're partnering with schools, so we're working on sometimes existing space and limited space inside buildings in order to serve the students. So we have all kinds of creative spaces. One of ours, as an example, was a chemistry classroom that wasn't being utilized at the time. So great for a clinic space because it has multiple sinks all along it that we can utilize for those purposes. So you can get fairly flexible with that. But what you do encounter when you come is typically a school-based health center staff that is very open door, welcoming, understands how to welcome students and community members into the space, not as formal as you might encounter in a typical medical home setting. And the purpose of that is to really ensure that those kids are feeling comfortable and confident to access those services. So we don't want that to be intimidating. This is very adolescent-friendly, child-friendly centers where, again, all are going to be welcome.
Well, in addition to essential primary care services, I know that a number of school-based health centers are beginning to add services to their portfolio. Increased behavioral health support, dental services, and some vision services. Could you talk a little bit more about these services and that evolution?
Certainly. So school-based health centers generally start with comprehensive primary care. So the primary care sort of being the anchor, of the service. And then oftentimes are looking toward how to address mental health. And that can look at a number of different ways relative to therapists that are there in the school, telepsychiatry services, primary care providers who are trained in primary care mental health. And you're right, we're seeing an expansion of dental care, and not just sealants. We're seeing people being able to do both a preventive and restorative care, even x-rays in school settings. Vision care we're seeing as not just a vision screen, but rather connection to glasses and even glasses repair. Also collaborations with specialty care. So for children who are having a hard time, following up on, say, frequent lab draws, how can the school-based health center collaborate with specialists to do some of those in between appointments? So lots of exciting things coming relative to the expansion of scope of care that's delivered in a school-based setting. But what I would say is really important in school health is, regardless of the type of care that we are offering in a school-based health center, it's really important that it's comprehensive. So generally speaking, these school-based health centers are located in places where individuals are disconnected from care or have a hard time with follow-up. So for example, you don't want to be doing, well visits at the school, but then say, gosh, I wish I could give you your vaccines due today, but I can't. You're going to have to go somewhere else. So it's important, that it is comprehensive. So again, regardless of the type of care, you tend to see successful school-based health centers being comprehensive. So for example, again, not just a vision screen, but a way to get glasses, right? So they're comprehensive, and then they're also linked to 24/7 care. So you want to make sure that the patients who are seen in a school-based health center, if they have a problem on a Saturday or a Sunday or over summer break, that those patients know exactly where to go, so that the care that they have access to is comprehensive and safe and year-round.
The other thing I'll add is that for many of our kids that might be suffering from chronic health conditions such as asthma or other, situations, the incredible thing about the school-based health centers is that those providers are embedded in the school. They're there every day. They can ensure follow-up for these conditions, so it's very easy for them to diagnose, treat, and follow. They often have great communication with teachers. So when I'm caring for kids in our school-based health centers that have mental health care conditions, it's a real collaboration. So the students, the parents, the community, we're all sort of wrapping our hands around together for that student to ensure that they're getting everything they need and their needs met. So as Mary Kay said, you don't want to be referring out because you already know there are barriers, and you're right there and you can have that comprehensive access for them over time. And that's really important.
Well, thank you both very much. I really appreciate your perspective. I'd like to add that we just posted a podcast on this topic, the latest episode in our Healthy Perspectives with Dr. Vanderhoff. It features a conversation with Dr. Vanessa Meyer, medical director for Metro Health's School Health Program, located up in the Cleveland area. You can find that podcast through our YouTube page, on Spotify, and also on Amazon Music. We'll put those links in the chat now. As we wrap up today, obviously the holidays are almost upon us. I'd like to take a few moments to talk about how we can stay healthy during this wonderful season. The first thing to consider with holiday gatherings is who is coming to visit. Do we need to be thoughtful about protecting people who are perhaps more vulnerable due to age or medical conditions? This in turn goes back to thinking about whether you've been vaccinated against respiratory illnesses. It also prompts us to think about indoor air, which can facilitate the transmission of some airborne diseases. Fresh air can make such a difference in preventing respiratory illnesses. So depending on the weather, consider cracking a window here or there. Another consideration is food safety. Every year, people get sick because they aren't following the basics, which we call the 4 C's of food safety. Those are clean, cross-contamination, cook, and chill. Clean involves washing your hands and surfaces often. It's simple, but very important. Second, avoid cross-contamination by making sure you use separate cutting boards for produce and raw meat, poultry, or seafood, as well as separate utensils and plates for cooked and raw foods. The third C is also simple. Cook food to the right temperature. Use a food thermometer to ensure that food has been heated enough to kill harmful bacteria. Turkey, for example, should be cooked to an internal temperature of 165 degrees. And the fourth C, chill, deals with both safely thawing food and also making sure it doesn't sit out too long. Thaw frozen food safely in the refrigerator, completely submerged in cold water, or in the microwave. Never thaw food on the counter, as bacteria multiply very quickly on food that reaches room temperature. That's also why you should never leave perishable food out for more than 2 hours. Enjoying leftovers, of course, can be a great way to extend the holiday meal. Just remember to put those leftovers in the fridge within 2 hours and to use them up within 4 days. I'd also like to put in a plug to try to build in some physical activity during the holidays. For example, there are many turkey trots on Thanksgiving, and in my experience, you don't even have to trot. Many times I've participated in these by walking with my family. Similarly, if it's a nice day, taking a walk together before or after eating is a nice way to get some exercise. Just be sure your healthcare provider has given you the green light for the exercise you plan before you start. It's my sincere hope that we all enjoy a happy, healthy holiday season with family and friends. And with that, Ken, I think we're ready to take questions.
Okay, thank you, Dr. Vanderhoff. Reminder to please only ask one question. And our first question today is from Krista Cano of Gongwer News Service.
Hi, Dr. Vanderhoff.
Hi. Krista, I can barely hear you.
Is this better?
Oh, that's so much better.
Okay. I wanted to ask if school-based health centers were one of the extra point things for the Rural Health Transformation Fund application that ODH recently submitted. And then can you talk about that application more generally? Thank you.
Sure. School-based health centers were highlighted in our application because we recognize that they're one of the great healthcare innovations underway already here in Ohio. And they really presented an opportunity for us to build on work that is already showing great promise and is very well suited to expanding healthcare delivery across our rural counties. And as we look at that application, I think I am very proud of the work that produced Ohio's application because it's work that reflected ideas, innovations, and perspectives from communities, organizations, and leaders all across our state, including school-based health centers. We're proud enough of that application that we posted quite a bit of information regarding our proposal on our website, including a program proposal narrative of 50 some pages that I'd encourage people to take a look at. And can we post a link to that in our chat to make it easier for people to find?
Just did.
Okay, super. Thank you.
Okay, our next question comes from Aaron Simonek with ABC6.
Hi, everyone. Can you hear me okay?
Yeah.
Okay. Hi, Dr. Vanderhoff. This is Erin with ABC6 here in Columbus.
Yeah.
Pivoting a bit to the Affordable Care Act, not sure if you could comment on rates with the Affordable Care Act that are expected to rise significantly in 2026. Looks like it's primarily due to the expiration of enhanced premium tax credits. And it looks like these subsidies could, possibly even more than double the cost for some enrollees.
Yeah, unfortunately, Aaron, at this stage, that situation is one that's very rapidly evolving. And of course, the state is actively through multiple agencies looking at those questions, but I don't have anything additional to add at this time.
Thank you.
Okay, and our final question today is from Joe Ingles, Ohio Public Radio TV.
Hello, thank you, Dr. Vanderhoff. I want to follow up on Aaron's question there. I've had several different people tell me that they are going to be without health care coverage beginning January 2026 because their health care premium, the insurance premium, is going up to even higher than their mortgage, and they just can't afford to keep it anymore. These healthcare centers that you're talking about that are in the schools, Medicaid patients probably can get care through those pretty easily, I would assume. But what about students who just lack health care and they don't qualify for Medicaid? there's a whole population there that's not being served. What about that one?
Yeah, so our school-based health centers actually use a wide range of mechanisms for assuring that we can deliver healthcare to the communities that are served. And I'll ask my guests if they might share a little bit about the framework that is applied for that. You know, one example that I can share is that some of these are operating under the auspices of a federally qualified health center, which they are structured in such a way to help overcome some of those barriers. But Dr. Irwin, Dr. Bode, anything that you could add to that?
Yeah, school-based health centers generally, as I mentioned before, are really trying to reach those individuals that you're speaking of. And so we certainly have the capability to bill Medicaid, as you alluded to, also private insurance. But everybody in this space is really trying to fill gaps. And so everybody pretty much has a strategy to support those individuals who cannot afford to seek care. And so, for example, Nationwide Children's never refuses care for inability to pay at any of our sites, and that is including our school-based health centers. And there are sliding scales that are offered by many different providers, and we are not alone in that. Generally, everybody in school health, and as Dr. Vanderhoff mentioned, the federally qualified health centers are a perfect example of entities that are trying to create access, acknowledging that those types of barriers exist, and we have solutions for families.
Now, the other thing we do at Nationwide Children's, and I know many of our partnering organizations do as well, is we have financial counselors that are working directly with our school-based health centers and staff to connect to families real time, to really individualize that response, to make sure that we're helping them to understand any and all options they do have for insurance. And then when they don't, or if they don't have those options, to then look at how we can continue to provide them care, without cost. So it's complicated, it's individualized, and so it really does take that extra step and work with the family. And that's what school-based health centers are all about.
All right, so I know I say one question each, but Joe has another question that I think Dr. Vanderhoff, you might want to answer. So go ahead, Joe.
Sure.
I'm sorry about this, but I've been wanting to ask this for 2 months. Okay, so adults who were vaccinated against measles during the mid-1960s received vaccinations that were less effective than the ones given before and after. Should adults who were vaccinated in that time frame receive another measles vaccine now, especially given the fact that there are so many people out there who aren't vaccinating their children? Sorry.
Yeah, so it's a very good question. And the adult vaccination guidelines at this time, I believe, do not call for folks to go out and get another MMR shot at this time solely for that reason. They're constantly, though, evaluating the data to look at vulnerability, et cetera. The vaccine was still a pretty good vaccine, and that'll continue to be looked at. And those guidelines could be updated over time. But right now, to my knowledge, that is not the case. And I'll tell you, I don't, Joe, have the vaccine guidelines immediately in front of me, but we will double check on all of that right as this closes, and I will get you a definitive answer in just a few minutes.
Okay, we want to thank everyone for joining us today. And Dr. Vanderhoff, do you have any closing remarks?
No, thank you all for joining us, and we look forward to sharing more information with you the next time.
All right, this will conclude today's press conference. Thank you.